Welcome to the Omnidental Podcast. Today we're diving deep into something really central to, well, our smiles, and maybe what happens when things aren't quite right underneath the surface. We're exploring the signs that might mean you need root canal treatment.
That's right. And for this deep dive, we're working from sources you provided, including some really useful info from Omnidental. They're based in Arlington Heights, Illinois, and actually offer this treatment.
Yeah, so our goal here is to unpack those key symptoms, the ones that suggest there's an issue with dental pulp, the soft stuff inside the tooth, and also get a clear picture of what a root canal actually involves, sticking just to the material we've got.
And it's really worth tuning into this because knowing these signs early, that can make all the difference. Honestly, it could be the difference between saving your natural tooth and, facing bigger problems later on. It's really about protecting your oral health, keeping your smile whole.
Okay, good point. So let's start right there. Root canal, it sounds a bit intense, maybe. What actually is it based on our sources? Like, what's happening during the procedure?
Well, the sources describe it as a dental treatment specifically for when the pulp inside your tooth gets damaged or infected. You mentioned the pulp. That's the soft tissue inside, right? Full of nerves, blood vessels, connective tissue, kind of like the tooth's living core.
The living core, so if that's in trouble.
Exactly. If it gets infected maybe from deep decay or lots of dental work on that tooth before, or even like a crack or chip that causes problems. So the root canal procedure is basically about carefully removing that damaged or infected pulp.
Okay, taking out the bad stuff. What happens next?
Right. So after removing the pulp, the next really important steps are cleaning out the inside of the tooth really well. That includes shaping those little canals inside the roots. And then this is crucial, filling and sealing that empty space.
And sealing, it stops bacteria getting back in, causing more trouble down the road. Is that the idea?
Yeah. That's precisely it. You eliminate the current infection, and then you protect the inside of the tooth from future problems. But the main aim, the big win, according to these sources, is actually saving your natural tooth from being pulled. It lets you keep the tooth working as part of your smile.
That's a really important distinction, because I think, historically anyway, people might link root canal with pain. But the sources mention modern procedures are different.
They do, yeah. They really emphasize that nowadays root canals are typically painless. You get good anesthesia. The techniques are refined. And they also stress how effective they are. They fix the problem and restore the tooth so it works properly again. So it's presented less as a dreaded thing and more as a, successful way to save a tooth.
That definitely helps frame it differently. Okay, let's get into the main part of this deep dive then, the signs. How do you know if your dental pulp might be in trouble and a root canal could be needed? The sources list quite a few indicators. Maybe we can group them. What are the things you might actually feel?
Okay, feeling things. Based on the sources, probably the biggest one is persistent tooth pain. And we're not talking about just a quick flash of pain.
Right, so persistent. What does that mean exactly? What should make someone pay attention?
Well, the sources talk about pain that just doesn't quit. It could be this dull, constant ache that goes on for days, or maybe it's sharper pain that keeps flaring up. And a big red flag is pain that's bad enough to wake you up at night. Any pain that sort of lingers and doesn't clear up needs checking out.
Got it. Pain that sticks around, major signal. What else might you feel? Anything with temperature?
Yes. Sensitivity to hot or cold is another one the sources highlight. Feeling pain when you sip hot coffee or bite into ice cream.
But isn't like a little bit of sensitivity normal sometimes?
Yeah.
How do you tell if it's the kind we should worry about?
Good question. Here's the key difference, according to the sources. It's when the pain lingers. It stays for a bit after the hot or cold thing is gone. With a healthy tooth, that feeling usually disappears almost immediately. If it hangs around, that's a warning sign.
Okay. So the tooth reacts, but if the inside is damaged, it stays irritated longer. Why does it linger like that?
The sources explain it's because those damaged nerves and blood vessels inside the pulp, they're basically hypersensitive. They react really strongly to the temperature change and just keep sending out those pain signals for longer than they should, like an overreaction.
Okay, that makes sense. So persistent pain, lingering sensitivity, two big things you'd feel. What about things you might see? Visual clues.
A really noticeable visual sign the sources mention is swelling in the gums, right near the tooth that's bothering you.
Swelling. What kind of swelling are we looking for? Just general puffiness or something specific?
It could be some general puffiness and tenderness near the root area. But the sources also specifically call out watching for a small, almost like a pimple, a little bump on the gum near that tooth.
A pimple on the gum. That sounds pretty specific. What does that bump or the swelling actually mean?
That type of localized swelling, especially if it's tender or has that pimple-like bump, sometimes called a fistula or an abscess, it's often your body reacting to an infection inside the tooth's root. The source explains it's like your body trying to deal with the bacteria that have gotten into the pulp, trying to fight it off or create a way for pus to drain.
So the swelling is like an external sign of an internal fight against infection. Okay. Any other visual clues?
Another pretty clear one is tooth discoloration. The sources mention a tooth starting to look dark, maybe gray or even kind of blackish.
Wow. Okay, that sounds quite dramatic. What's happening when a tooth changes color like that?
According to the sources, that kind of dark color is a strong sign that the pulp inside the tooth, that living tissue, is dying or maybe has already died. This often happens because of some trauma to the tooth or a deep infection. It's a very visible signal that, yeah, root canal treatment is probably on the cards.
So the tooth itself is visually telling you something serious is wrong inside. Okay. We've covered feeling pain and sensitivity, seeing swelling or discoloration. What about pain just using the tooth, like chewing?
Yes, that's another key area the sources point out. Feeling pain when you bite down, when you chew, or even just when you touch the tooth lightly. That's listed as a really significant symptom.
So it's not just random pain or temperature pain, but pain from actual physical pressure.
Exactly. That discomfort, especially when you put pressure on the tooth, strongly suggests, according to the source material, that the infection has probably spread down to the root area. It causes inflammation in the tissues and maybe even the bone around the tip of the root.
Yep.
So yeah, it points pretty directly towards needing a root canal.
Makes sense. Pressure on an inflamed spot is bound to hurt. And sometimes the issue isn't just internal, right? It's actual visible damage to the tooth. How do chips or cracks fit in here, according to the sources?
Right. The connection is about how that damage can breach the tooth's defenses. A chip or a crack, even if it seems small, can basically open up a pathway. It exposes that inner dental pulp to all the bacteria that naturally live in your mouth.
And that exposure leads straight to infection.
Pretty much, yeah. The sources say it creates a direct route for bacteria to get into the pulp chamber, causing infection and inflammation. That's why they advise getting any chip or crack checked out by a dentist quickly, even if it doesn't hurt right away, because that damage can be like leaving the door open for infection to start later.
That's a crucial point.
Yeah.
Don't ignore even small damage, because it's an invitation for bacteria. Okay, let's quickly recap those main signs from the sources. You've got persistent pain that won't quit, sensitivity to hot or cold that lingers, swelling or that little bump on the gums, a tooth darkening in color, pain when you chew or touch it, and actual damage like chips or cracks exposing the pulp. That's a pretty clear checklist.
It really is. And just recognizing any of these is the vital first step to getting the right help.
Okay, so if someone is experiencing these, understanding the actual procedure might help reduce any anxiety. The sources give a quick overview. Can you walk us through the steps briefly?
Sure. The sources lay out the typical process. First things first, they numb the tooth really well with local anesthesia, so you're comfortable.
Good. Managing pain during the procedure is key.
Absolutely. Then the dentist makes a small opening, usually in the top of the tooth, to get inside to the pulp chamber. Then they carefully remove the damaged or infected pulp tissue, the nerves, blood vessels from inside the chamber, and the root canals.
Cleaning out all that compromised material.
Exactly. A very thorough cleaning. Once the pulp is out, they clean, disinfect, and shape the inside spaces, the canals. Then they fill that cleaned out space with a special rubbery, biocompatible material, usually something called gutta percha.
And then comes the sealing part.
Yes, the canals are sealed up to block off any future infection. And finally, they close the opening in the tooth, usually with a filling. Oh, and the source also mentions that quite often a crown is put on the tooth afterwards.
Right, the crown. That's for protection, to restore its strength and look.
Precisely. It gives the tooth full protection, especially since it might be a bit more brittle after the procedure and makes it look and function normally again. The sources also note these procedures are pretty efficient. Sometimes done in just one visit, maybe two, depending on the case.
1 or 2 visits, that sounds manageable. Okay, now the big so what? The sources really hammer home the importance of seeing your dentist quickly if you have these symptoms. Why is acting early so vital?
Yeah, this comes up again and again in the material. It's maybe the most critical message. See a dentist as soon as you notice something's wrong.
What are the risks if you wait? What could happen?
The sources are pretty direct about the downsides of delay. A major risk is losing the tooth altogether. If the infection gets too bad, a root canal might not be enough to save it, and extraction getting it pulled becomes the only choice left.
Which is obviously something most people want to avoid, losing a natural tooth.
Definitely. Waiting can also lead to an abscess forming that painful pocket of infection, sometimes visible as that gum boil we talked about. And more seriously, the infection can actually spread beyond the tooth. It could affect your jawbone or potentially even other parts of your body.
Wow, so what starts in one tooth can become a much bigger health problem.
That's the risk, yes. The sources are clear. Catching it early massively boosts the chances of saving the tooth successfully. They also point out that most dental work, root canals included, is just generally easier, quicker, and more likely to succeed when the problem is treated early before it gets really severe.
That makes total sense. Fixing a small leak is easier than dealing with a flood.
And there's a pretty stark warning in the sources about waiting too long. They mention that if the damage inside or the infection is really extensive, or if it's already spread significantly into the bone around the tooth, it might actually be too late for a root canal to work. In those cases, extraction might be the only viable path, which just highlights again why you need to act on those early signs.
That really underscores why noticing those symptoms early isn't just helpful, it's potentially crucial for keeping your tooth. Now, as we said, this deep dive was partly informed by sources including OmniDental. For anyone listening in the Chicago suburbs who might be recognizing these symptoms, where exactly is OmniDental located, according to the source?
The source material places OmniDental right in Arlington Heights, Illinois. The address given is 305 E. Rand Road.
Okay, Arlington Heights. Do they just serve that town or a wider area?
No, it's wider. The sources say they provide comprehensive dental care for people in Arlington Heights and quite a few of the surrounding communities. It lists Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, DePlain, and Elk Grove Village, too.
That's a pretty big area in the northwest suburbs. And just to confirm, the sources say they definitely offer the root canal therapy we've been discussing.
Yes, they do. Root canal therapy is specifically listed in the source material as one of the comprehensive dental services OmniDental provides.
Does the source material mention anything else about their practice? Their approach, maybe?
It does highlight a few things. A patient-centered approach focusing on comfort and building relationships. It also mentions they use advanced dental technology, suggesting that helps with, accurate diagnosis, efficient treatment, and better comfort for the patient. And it points out that the lead dentist, Dr. Bilas Poles, has over 10 years of experience treating all sorts of dental problems, including the complex stuff.
Right. Experienced tech, patient focus sounds like important stuff when you might need a procedure like this. So for listeners in that area, hearing about these symptoms and thinking, that sounds like me, how does the source say they can get in touch?
The source gives a direct phone number. It encourages anyone experiencing these symptoms to give OmniDental a call at 847-483-8833.
Great. 847-483-8833. Okay, let's wrap this up. We've looked at what a root canal actually is, a way to save a tooth by cleaning out the infected inside and sealing it. And critically, based on our sources, we've zeroed in on those key warning signs. That persistent pain, lingering hot-cold sensitivity, any swelling or bumps on the gum, a tooth changing color, pain when biting or touching, and also chips or cracks. And we talked about why catching these signs early is so important to avoid bigger issues, like losing the tooth.
Absolutely. Understanding these signs really does empower you. It helps you recognize when something serious might be going on so you can get professional help promptly. And that dramatically increases your chances of saving your tooth and keeping your mouth healthy.
So here's a final thought to chew on. How often do we kind of ignore little signals from our body? Maybe hope a small ache or weird feeling will just sort itself out. What if those signs we've talked about, the persistent ache, the lingering sensitivity, the discoloration change, what if those aren't just minor annoyances, but your body's early warning system for your teeth? Really listening to those specific signals, it isn't just about treating a symptom. It could be the key step that stops a whole cascade of problems, potentially saving you from tooth loss or much more complicated treatment later. Maybe consider the real value in tuning into those signals your body sends.